We're going to continue in this theme focused on World Rabies Day. We're moving now towards Tunis, and our colleague, Dr. Mariem Handous from the Pasteur Institute in Tunis. You'll recall our discussion at the end focused on the potential role of linear flow tests, gold standard tests, and point of care diagnostics. And so we're looking forward to Dr. Handous to continue this discussion, and in particular based on her experience in her locality in the Northern African region. Mariem?
Thank you very much, Dr. Ruprecht, and thank you very much for giving me the opportunity to present our work in the Pasteur Institute of Tunis. So we'll share the screen. So my presentation is about the technical commitment in the fight against rabies of the Rabies Laboratory of the Pasteur Institute of Tunis. So the Pasteur Institute of Tunis was founded since 1893. It was dedicated to infectious diseases related to global health, human health, but it made possible the diagnosis of rabies both in humans and animals. The preparation of rabies vaccine was also made in the institute, and the treatment of bitten persons. We have in the history of this institute a Nobel Prize with Charles Nicholl. So the diagnosis saw an evolution through the time. So at first, it was based on identification of negri bodies and inoculation of rabbits and mice. It was mainly in the pathological anatomy department, and since 1995, specified the laboratory for rabies was established, and using the recommended techniques such as FAT, RTCIT, molecular biology, and also techniques related to serology. So in terms of rabies surveillance, so we are the only laboratory in Tunisia who make the rabies diagnosis, both for humans and animals. So like the diagram shows, the rabies epidemiology surveillance network. Veterinarians from the agricultural ministry, private vets, or even citizens bring us samples of suspected animals. So we make the diagnosis, and we provide the positive cases. We inform the agriculture ministry, and also the health ministry, and the Directorate of Care and Basic Health, which deals with a whole program of rabies control. So this helps to manage animal cases and bring an efficient post-exposure prophylaxis for people who were in contact with these rabies animals. Also, it helps to make the prevention regarding the animals or people who were in contact with rabies animal. Inform the population, because lastly we decided to put the confirmed animal cases on Facebook, on a page on Facebook, to inform the whole population about the zones, the areas where there are confirmed animal cases, so they are more aware about the disease, And also, they are more encouraged to vaccinate their animals because there is a high risk of contamination. And rabies surveillance helps also to evaluate control measures. So in areas where there are rabies cases, we contact the vets to tell them that maybe the vaccination coverage is not really sufficient in this area, and more efforts are should be made. Also, rabies surveillance is a key point for advocacy because when we are in contact with stakeholders, having statistics, numbers, and maps of rabies cases is a very important point to make them more engaged and more convinced about the importance of fighting this disease. So rabies is a challenge, and especially when we have a small team and limited resources. But through even if we have these challenges, the engagement and the aim to reach the 0 by 30 is important, and we are working on rapid and efficient feedback for veterinarians in the field. And when we provide the results within 24 hours maximum, they are more confident regarding our diagnostic, and they are more encouraged to make their surveillance, to bring the samples, because they know they will have a response in a quick time. We also try to support clinicians for the follow-up of suspected human rabies cases. So we try to have the maximum of samples to even confirm or not the case, and until there are another diseases which are confirmed, or unfortunately when there is a rabies case. And when there is a rabies case, especially for human cases, there are the contact with clinicians is very important to remind them that they have to have PEP, because clinicians don't always have pre-exposure prophylaxis, and also to manage the family of the victim. I think the most important point in Tunisia is that the rabies diagnosis is free of charge. So this helps to improve the surveillance and to have more samples. We gained trust, I think, from veterinarians and citizens when we bring rapid response regarding suspected animals. And this help us to have a better surveillance and to improve the surveillance year after year, as you will see in the next slides. So since 1982 to 2021, we had up and downs regarding animal cases and human cases. So in green, there are the human rabies cases, and in red, animal rabies cases. And it's clear that human rabies cases are related to the animal rabies cases. So every time we have an increase in animal rabies cases, we automatically have an increase in human rabies cases, unfortunately. And we had 4 time periods that I would like to emphasize on. So it's 1985, 1988, 2001, and 2009, which when we reached the 0 human cases. So in Tunisia, we already reached the 0 human cases, but our experience shows that reaching this number is not a final goal, because we have to work on reaching the 0 at least canning cases, yes. Because when we reach the 0 human cases, sometimes we feel we reached the goal, and there are less efforts that are made for vaccination. So after this period, the cases come to raise again. And unfortunately, rabies is the disease that is related to humans and their social, economic, and political situation. So since the revolution of 2011, rabies cases really increased a lot. And unfortunately, till now, they are still going in high levels. And I think the major cause is vaccination, is the lack of that vaccination, and also the dog population management related also to waste management. And all these numbers are available thanks to all the people that helped in rabies surveillance and bring the samples. So reaching the 0 by 2030 is possible in Tunisia, but it's not a final goal. We have to focus on elimination of rabies in dogs and animals. So our laboratory contributes also to answering questions from the field, like the effect of the vaccine. Is the vaccine really efficient or not? And other questions like this. So for these questions, like in the picture, we managed to make a sero-epidemiologic study. So we made samples of blood in dogs, and we studied the serology, the antibody kinetics over a year. And also we try to adapt our strategies to new realities, like political and social issues. We try also to share our knowledge to people, to doctors, to veterinarians, and to make them more aware about the disease. And we collaborate for like the last twinning project that we are preparing with the ANSES in France, in the hope of having the status of an WOAH reference laboratory. So our laboratory is involved even in awareness, vaccination, answering research questions, and being always in touch with people in the field, because they have the key to eliminate rabies, and we are all engaged to fight this disease. Everybody in the whole network, in the whole sphere of the rabies fight, is engaged and could have an impact on the fight against rabies. So I would like to thank everybody, and especially my team, the team of our laboratory, and all the people who bring their samples and were engaged in the fight against rabies. Thank you very much.
Great. Thank you very much, Mariem, for sharing your experience with us. And I'm curious, what do you think is one of the greatest limitations to enhancing surveillance in support of canine rabies elimination in your experience in Tunisia?
I think, like I said, the most important point that the diagnosis is free of charge. So people are more encouraged to bring the samples or to contact the vets when they have a suspicion. And the other point is to have a quick response, to not to wait for weeks to have a response regarding the samples that they bring. But awareness also is very important to convince people to bring the animals or to contact the vets to about a suspected case, because if they are not aware that it could be rabies, they would not have gone to the vet at all. So awareness also is very important to convince people, and also informing people that rabies exists, and even if in their area, it's very important to encourage them also to make the surveillance.
Very good. Thank you.
You're welcome.